Hey, welcome back to Political Detox. Now, what if I told y'all Obamacare was never about you? It was about them, the insurers, the middleman, the bureaucrats, and now Trump's flipping the table. Not with more paperwork, but with the healthcare grenade called the HSA. You control the cash, you choose the care, you become the system. Simple as that. So let's get into this. We're going to compare Trumpcare to Obamacare. So drop a comment and tell me what y'all think.
Donald Trump's vision for healthcare has often revolved around the idea of health savings accounts, HSAs, which he frames as a way to give individuals more direct control over their medical spending. Rather than funneling government subsidies through insurance companies, Trump has argued that money should go straight into accounts managed by the people themselves. In his words, he wanted Americans to feel like entrepreneurs of their own healthcare, empowered to shop for coverage and services without bureaucratic interference. At the core of his proposal was the concept of federally funded HSAs. Instead of subsidizing insurers under the Affordable Care Act, the government would deposit cash into accounts that individuals could use to purchase insurance or pay for care. This approach was designed to shift power away from large insurance companies and toward consumers, who could decide how best to spend their health dollars.
It could look like it's a no-brainer. Do HSAs feel like a smart way to take control of your health care, or just another layer of confusion? Would you rather hold the cash yourself? Just curious. I want to hear from y'all. Comment below. Let me know how y'all feel.
Trump also pushed for legislation that expanded eligibility for HSAs. His initiatives opened the door for millions more Americans to participate, like those signed up for ACA marketplace plans, direct primary care arrangements, and telehealth inclusive coverage. By broadening access, he sought to make HSAs a mainstream option, rather than a niche benefit tied only to high-deductible health plans. The appeal of HSAs lies in their triple tax advantage. Contributions are tax-deductible. Investment growth inside the account is tax-free, and withdrawals for qualified medical expenses are also tax-free. Unlike flexible spending accounts, HSAs don't expire at the end of the year, funds roll over, creating a long-term safety net that can even function like a retirement account for health costs. Trump's proposals also emphasized modernization. He supported permanent safe harbors for telehealth services, allowing high-deductible plans to cover virtual care without jeopardizing HSA eligibility. This reflected his broader push to integrate technology into healthcare delivery, making it more accessible and efficient. Supporters of Trump's HSA model see it as a way to cut costs, reduce dependence on insurers, and give families more freedom. Critics, however, warn that shifting subsidies into HSAs could destabilize the ACA's marketplaces and leave lower-income Americans underinsured, since cash deposits may not cover the full burden of high medical expenses. In essence, Trump's healthcare narrative is about direct empowerment. He branded HSAs as Trumpcare, positioning them as a replacement for Obamacare and a symbol of his philosophy. Government should provide resources, but individuals should control how those resources are spent. Whether viewed as a bold reform or a risky gamble, his HSA plan represents one of the clearest examples of his preference for market-driven solutions in health policy.
If y'all still with me, I want y'all to hit that notification bell so you'll be notified of any and every upcoming video, because you know how YouTube is. They have a tendency to try to thwart the conservative movement. So sit back while we weigh the difference between Trumpcare and Obamacare.
Ever wondered who's really in the driver's seat when it comes to your healthcare dollars? Is it the government, the insurance companies, or you? Today, we read diving deep into a hot topic: Obamacare versus the kind of healthcare plans often talked about as Trumpcare, specifically looking at the Affordable Care Act versus health savings accounts. Again, I want to encourage you to give us a thumbs up, subscribe, and comment whether you prefer the ACA or the HSA insurance plan based off the information provided to you in this video, and please feel free to tell us why. We listen and respond back. Let's break it down and see what it all means for your wallet and your well-being. First up, let's talk about the Affordable Care Act, or ACA, widely known as Obamacare. The main goal of the ACA was to make health insurance more accessible and affordable for everyone, especially those who couldn't get it through their job or had pre-existing conditions. Think of it like a giant safety net. The ACA requires most people to have health insurance, and to help with the cost, It offers subsidies or tax credits if your income is below a certain level. It also set up online marketplaces where you can compare and buy plans. A huge part of the Affordable Care Act is its consumer protections. For example, insurance companies can't deny you coverage or charge you more just because you have a health issue like asthma or diabetes. They also have to cover a list of essential health benefits, like hospital stays, prescription drugs, and preventive care. So with Obamacare, you're paying a monthly premium for a comprehensive insurance plan. The idea is to have predictable costs and protection against massive medical bills. Now, let's switch gears and look at an alternative approach often associated with Trumpcare and other Republican health proposals. The Health Savings Account, or HSA. An HSA isn't insurance itself. It's a special savings account that you pair with a high-deductible health plan, or HDHP. The idea here is to give you more control over your healthcare spending. Here's how it works. You contribute money to your HSA tax-free. That money can then be used to pay for qualified medical expenses. Again, completely tax-free. The money in your HSA rolls over year after year, and you can even invest it to grow over time. It's your money, and you decide how to spend it. The insurance part, the high-deductible health plan, typically has a lower monthly premium than a traditional ACA plan. However, you have to pay more out-of-pocket for your medical care before your insurance starts to cover the costs, that high-deductible part. The HSA is meant to help you cover those costs until you meet your deductible. This approach emphasizes personal responsibility and market competition, hoping to drive down costs by making consumers more price-conscious. So what's the real difference in who controls the money? With the ACA plan, you pay a regular premium to an insurance company. In return, they manage the financial risk and cover a large portion of your medical bills according to the plan's rules. You have less direct control over the dollars day to day, but you have more predictability and protection against catastrophic costs. On the other hand, with an HSA and a high-deductible plan, you are in direct control of the money in your savings account. You're the one deciding which doctor to see and how to pay for it using your HSA funds. This gives you more freedom, but also more responsibility. You need to be a savvy healthcare shopper and save enough to cover your deductible if a major health issue arises.
Exactly. If and when this goes into effect, look, when you're dealing with an HSA-based plan, insurance isn't something you just sign up for, it's something you shop for. Just like car insurance, just like life insurance. You don't just grab the first policy that pops up, you dig? You compare, you ask the right questions. Know what you're getting, know what it covers, and know what it doesn't. Be an educated consumer, and treat your HSA like credit, not like a blank check. Let it build, let it grow, and let it mature like a real savings account. Because in this system, the smarter you are, the stronger your safety net becomes.
Which one is better? Well, it really depends on your personal situation. If you have chronic health conditions or expect to need regular medical care, the comprehensive coverage and predictable costs of an ACA plan might be a better fit. The subsidies can make it very affordable if you qualify. However, if you're generally healthy, financially disciplined, and want more control over your healthcare spending and a way to save for future medical expenses tax-free, an HSA-based plan could be a fantastic option. It encourages you to save and puts you in the driver's seat. The key is to understand your own health needs, your budget, and how much financial risk you're comfortable taking on. Ultimately, the debate between these two models is about different philosophies. One prioritizes community-rated insurance and social safety nets, while the other champions individual control and market-based solutions. Understanding both is the first step to making an informed decision about your own health and financial future.
I want to thank those of you who stuck to the end. Watching the video is very important to the YouTube algorithm. And I hope this video cleared up a lot of points in the difference between Trumpcare and Obamacare. Hit that notification bell so you won't miss any upcoming videos. We have more in store for you on this particular topic. So stay vigilant, stay tuned. Thanks for watching.